Hi everyone, my name's Ellen and I'm going to be your nurse today. And this is RN Aware, a hopefully weekly show where I tell you what I wish you knew when you came into the emergency department. For this week's video, I'm going to talk about the process, the steps you go through when you come to the emergency department, kind of what you can expect and when you can expect it. As with any video I will put on this channel, this is all based on my experience and where I work. This is not saying that this is exactly how every emergency room runs. So the first thing that should happen when you come to the emergency department is that you should get registered. That's getting your basic information, your name, your birth date, address. This is showing me, hey, John Doe is here. Sometimes registration at that time will take your insurance cards, photo ID, and have you sign a couple consent forms. Typically, registration will ask for a chief complaint. They're only looking for 1 to 2 words, not the whole story. The whole story comes to me when I'm in triage. So triage is your first step after getting registered. That's that first medical person you see, that first nurse. Where I work right now, we have triage rooms, so we pull people out of the waiting room to give them some privacy. At my hospital, the triage nurse is somebody who has had several years of emergency room experience and has competencies they have to keep up on. My goal in triage is to get your information, verify what I have in the computer, get some vital signs, and if I need to, get some stuff started on you. The question I always ask is, what brings you to the emergency department today? And I want to hear everything. If you have belly pain, I want to hear how long you've had it, where it is, what it feels like. But I also want to know the yucky stuff too. Are you pooping blood? Is it just a stream of diarrhea? Are you not peeing at all? Have you not peed since yesterday? How about eating? Are you vomiting? You can tell me the gross stuff. It's okay. I won't get freaked out, but I need that information. I'm also going to take your vital signs. Now, a lot of people are anxious when they come to the emergency room. You're nervous, you're scared, you're probably in pain. This isn't your everyday. That's okay. But when you feel this way, your blood pressure tends to go up. Now, as an ER nurse, I have slightly different parameters for what high blood pressure is than your primary care doctor has. So if your blood pressure is a little elevated, say 160 systolic, for you and for your primary care doctor, that may be considered high. But for me, I'm not too worried about it. And I'll tell you that. But you're in pain and you're a little bit nervous. It's allowed to be elevated. I always joke that my blue triage chair makes people nervous. So another thing I'll do in triage, if the actual department is full, I don't have a bed to put you in right away, is something called a protocol. An order set that doctors have agreed on that I can click on and get stuff started. So for abdominal pain, depending where it is, it has a slightly different order set. But I can click on that, get your blood work, get a urine sample, and get maybe an EKG if it's more of an upper abdominal pain. I can get that stuff from you and get those orders started. That way, by the time I do get you back to a room, we already are starting to get some of those answers back. Same with you have chest pain. Unfortunately, it is a very rare reality that chest pain does not automatically mean a bed, especially if I'm very full. However, out in triage, I'm going to get your EKG. I'm going to draw your blood work. I'm even going to order a chest x-ray. All that stuff is going to get started. As long as your vital signs show me you're stable and that you're okay to wait and you don't look like the Grim Reaper standing right behind you, I may have to make you wait. Sorry about that. That's the nature of the beast. Protocols are something that can be ordered by the nurse. Sometimes in triage, we have a provider out there with us. We call them PIT, provider in triage. This is either a nurse practitioner or a physician assistant. They're someone who will come in with me. We'll all ask you the same question. That way we get all the story at the same time. They're able to order more imaging like CT scans, ultrasounds, more than one x-ray. That way we can get all that information started, even if I have to send you back out to the waiting room. They can also order different labs, blood work, that type of thing, if that needs to get started as well. So if I'm doing a protocol or the PIT provider is there with me, typically that means the whole department is full and I don't have a bed right now. We're going to get stuff started, but we're going to send you back out to the waiting room. But we'll get you to a room as soon as we have one available. Unfortunately, sometimes we have to have patients wait in the waiting room. We don't like to do it as much as you don't like to sit and wait. One of the worst things that happens while people are in the waiting room is patients that came in after them are going back before them. That is very frustrating to patients, but there is reason to that. When you're in triage, one of the things I do is assign you an acuity. Where I work, we use the Emergency Severity Index. Basically, it's a number between 1 and 5. 1 being very, very critical, and 5 being stable and needing no resources. There are different definitions for what is and is not a resource. I don't even know them all off the top of my head. Typically, if you're sitting in the waiting room and you see someone who came in after you go back before you, that usually means they're pretty sick or they have a higher acuity. At my hospital, we see a lot of 3s, which is kind of middle of the road. They're sick patients who need several resources, but they're stable. Part of the reason we do these protocols and have this PIP provider come out is as we get results back, your acuity can change. If we see very low blood counts or very high potassium, that can kind of change your acuity and maybe get you back a little faster. So us getting that blood work started only helps you in the long run. When you're waiting in the waiting room, one thing we ask is please don't eat and drink unless you talk to the nurse first. Most of the members of my registration know that pretty much nobody can eat. Just in case something needs done, surgery, any type of procedure that you have to be NPO for. Some gallbladder ultrasounds you can't have eaten for. If you eat and drink, that's just going to delay your care. So please do not eat food before you talk to registration and they've talked to the nurse. Like I said, the members of my registration team are amazing and they know I really don't let people eat at all. After you've been waiting in the waiting room for a little bit, I'll come out eventually and call your name to bring you to a room. I can't tell you how long it's going to be. There is no standard number. Now, some of my older population gets a little bit nervous when they hear I'm going to take them to a room. They think they're being admitted to the hospital. This is not true. When I say I'm taking you to a room, I'm taking you to one of the ER rooms, an exam room, where you're going to see one of the providers in the back, whether it's a doctor, another PA, or an NP. So once I get you to a room, you have to get undressed, at least partially. If it's a leg problem, I need your pants to come off. If it's anything above your hips, your shirt, and ladies, your bra needs to come off. Okay? Arm pain, I want that shirt and bra off as well in case I have to put you in a cast or something. It's going to be harder later. I'll give you a few minutes to get dressed. If you need help, tell me. Tell whoever takes you to the room. I don't want to walk in a few minutes later and you're sitting on the bed and go, I'm sorry, I can't move my arm behind me to get my shirt off. We're going to get you all settled in the bed as much as you can. I know some people are uncomfortable and can't really sit. We try to work with you the best we can. And we're going to hook you up to the vitals machines. We, in my ER, will hook you up and keep you on it. We don't take it back off. That way, while you're there waiting, which can take several hours, the vitals can keep going, keep monitoring you. It's not continuous. Our blood pressures we typically set to take every hour. After you're in there, one of the providers will come in. They'll examine you, but they really want to know, same thing I said, why are you here today? If they need to, they can order additional labs. They can also order you meds, those pain meds you've been waiting for. They're the people to do it. So if you didn't get a protocol or the PIP provider out front saw you, once you get to a room, that's when we're going to get some stuff started. Typically at my ER, we say 2 hours for everything to come back after it's done. So if you don't go to CT scan until an hour and a half after you've been there, it's going to be 2 hours after that. My providers typically will not come in until they have all the answers back. All the labs, all the blood work. They're going to wait for all the scans. They're going to wait to have that whole picture so that when they come in, they can tell you what's going on. Please do not ask me to give you results. That is out of my scope of practice. I can't give results. That being said, after a doctor has given you results, if you're kind of confused and you said, hey, Dr. Smith just kind of ran through everything real quick. I'm not sure what any of it means. Can you help me? I will absolutely go through number by number what that means for you. But I can't be the one to give you the initial results. But I will gladly review what he said with you. After all the labs come back and we get all that information back and we know what's going on, at least partially, the provider is the one who decides whether you need to be admitted or discharged. So a lot of times when I'm triaging people will ask, are they going to keep me? And truth be told, I usually have a decent idea if they're going to keep you or send you home. but I don't know for sure and I don't make the decision. Once they decide, that's when we set some wheels in motion. You know, if you're going to be discharged, do you need prescriptions, additional meds? If it's a kidney stone, do you need a strainer for your urine? Do I need a tech to put a splint on you? Do we need to get crutches? What kind of teaching do I need to do? If you're going to be admitted, that process gets a little longer. People tend to assume the second the doctor says, oh, you're being admitted to the hospital, that boom, they're going upstairs right now. This is entirely not the case. If you're going to be admitted, the next steps is the doctor puts in the admission request, has a conversation with the hospitalist, which is kind of like the family doctor, but in the hospital. They come down, they do the same thing that the ER doc did, but they're going to review everything. All your medical history, they're going to look at you over head to toe, as opposed to where the ER docs are kind of going to focus on your problem. Once the hospitalist has seen you, they go and they put in orders. Once those orders are in, then bedboard, who sits on high in their ivory tower, assigns you a bed. It's not an immediate process. It takes a bit of time. Especially at my hospital, we tend to be full a lot. That's why we expanded. So it takes a little bit of time. Not everything is instantaneous. But be patient. If you are stuck in the ER after you've been admitted for a time, everything that would be getting done upstairs is done in the ER. It's just a little bit of a different setting. If you're getting discharged, I'm going to bring you a stack of papers. Sometimes there's prescriptions. Sometimes it's just your after visit summary, which is kind of your get out of jail free papers. If I need to, a brace or crutches or a urine strainer that I mentioned before. It's a really common thing. I bring a lot of those in. Or if you're going to need an inhaler, typically I'll grab a spacer to give to you so you don't have to worry about buying one. Just makes using an inhaler a little bit easy. So typically my providers will write a little summary of what you need to do, and I'm going to make sure I review that with you. Things like take Tylenol or ibuprofen per over-the-counter instructions. Make sure you stay hydrated, eat a bland diet, rest for the next couple days. If you have a work note, I'm going to make sure you know that it's on there, that it's signed, and when you can go back. I'm going to make sure that if there's any workman's comp paperwork you need to sign, that gets signed. Any other forms you need to fill out, I'll make sure those get taken care of. I'm going to go over your prescriptions. Make sure you know what's written on there and what they're for. If you're confused, say, Ellen, I don't understand. What is Zofran for? I'll tell you it's for nausea. And I'm going to tell you how to take it and when to take it. Typically with like an antibiotic that tends to be multiple times a day, I'll tell you breakfast, lunch, and dinner. Or if it's 4 times a day, when you wake up, lunchtime, dinner time, bedtime. I'll tell you kind of exactly when to take those if I can. Or if I gave you a dose in the ER, I'm going to make sure you know, hey, don't start this till tonight or don't start this till tomorrow. We already gave you a dose here. If you have questions, stop us. Ask us. We go over these meds really frequently, so we don't always think about what all needs explained. Like this is Zofran. I know what Zofran is. It's for nausea. But you may not say, what's this for? Or, yeah, this is an antibiotic, this is a steroid, this is that. What are my side effects? What do I need to look for? Do I need to do anything differently? Ask me questions. I want you to go home and feel confident that you know how to take care of yourself so that you don't have to come back to the ER. So that's kind of a brief summary of what you can expect when you come to the hospital. If you guys have any questions, whether it's about this process or other questions that you want me to answer, I'm going to put my email down below. Feel free to send me an email. I'll try to answer you. And if I get enough, maybe I'll make a Q&A video in the future. But I have 1 subscriber right now. So hi, 1 subscriber. Like and subscribe if you want to see more of my face telling you things that you wish you knew. As always, take your medications as prescribed, drink plenty of water, and I'll be back in a little bit to check on you.